Many women have it, none of us can stand it. We're talking about cellulite, but there's a way to get rid of the unwanted dimples. Welcome Dr. Edward Bednar from Bednar Cosmetic Surgery. It's great to see you, Dr. Bednar. Thank you for being here.
Thank you.
Okay, cellulite, that evil, dirty little word, we can't stand it. And it seems like no matter what your weight is, no matter how much you exercise, no matter how many lunges you do, you still can't get rid of it. Why is that the case?
It's a congenital problem, so there's that congenital tendency. So there's really very little you can do about it. And you can see it. A lot of the ladies say, they've had it since they were quite young. Didn't matter that what they were weight-wise, they still had it. We have a solution. And the thing
Tell
is,
us about the solution.
The solution. Now, it is minimally invasive, and maybe there's a day or two of downtime, but it's, as I said, we do it under twilight sleep. It involves a laser that takes care of the three separate elements of cellulite and really makes a remarkable difference. I mean, the testimonies that we get, and you can see us marking a patient here. We're going to release these. The testimonies and the feedback we've gotten after hundreds of patients in the last year and a half, because it's only been available in the last year and a half. I've had ladies who said they hadn't worn shorts for 30 years, and they hadn't worn a bathing suit without a surround. And so they're in a bathing suit now. They're at the Caribbean, they're at poolside at home, they're very comfortable now in their skin. Another lady said she had some glamour shots done. The boudoir shots were featuring her legs, which would never have been possible before.
Right. That's why you're excited about Cellulaze, because in all the years that you've been in this business, this is the only thing that really makes a difference and works.
This is what works. And even now, I think that ladies, they're skeptical, and the reason for it is they've spent thousands and thousands of dollars on things that haven't worked. But now we have something that works. So minimally invasive, as I said, very little downtime, remarkable results, tremendous feedback. We've got plenty of patients who would be more than happy to talk with you about it.
Can we see some before and after pictures, because Dr. Bednar is telling you about these dramatic resulls, but this really shows it.
And you can expect about a 70 to 80%, and then we get these 90 to 95%. Here's a lady who couldn't wear shorts for 30 years. Remarkable differences. So, I mean, from the standpoint of these patients, as I said, they're ecstatic. A 96% satisfaction rate with this procedure. It's unlike anything else we've ever been able to offer patients before.
How quickly do you see results? Does it take a while? Do you need
you'll
multiple
see
treatments?
You're going to wear a garment for about 3 weeks. When the garment comes off, you're already seeing the results. Over time, the skin's going to thicken up. It's a regenerative process. The 30% increase in the thickness of the skin smooths out, and you'll see that real big bump between 6 and 12 months, where it's really remarkable.
Great, Cellulaze. Can we switch gears for a second, because I see you brought something that I'm very familiar with, a skincare product that you have formulated. You created this, correct?
That's right. Well, my undergraduate degree is in chemistry, and so from the standpoint of that, I knew that we could take the products that we know to be pharmacologically active in skincare and place it into a single step. And so I was able to formulate this product line. We began about 3 to 4 months ago introducing it to our patients, and our long-standing patients we've got a good relationship with. Feedback's been tremendous. We can't keep it in stock. I mean, we're getting our own packaging for it as well, but it works extremely well. And it's a single step. It's a single step. It takes and condenses it down. And we use it at night. We suggest you use it at nighttime. You don't need much. This little 1-ounce model usually lasts anywhere from 2 to 3 months. There's a good economic savings as well, but bringing it down to a single step, I think people are busy. It's difficult to push yourself through a regimen of 3 to 6 steps. We can get the same results, if not better results, using this formula.
Well, it's true, because we put the serums on, and then the moisturizer, and then the next thing, and it is I've been using this. I use a teeny tiny amount, just like a little bit. And people have been asking about my skin, and that's the truth. So I'm happy to tell you that. Yeah, so I'm really happy with it.
That's the feedback we've gotten. It's been very, very good. Patients love it.
Yeah, I really do. Thank you, Dr.
Well, it's all part of the continuum. We can get you from start to finish, both the non-surgical and the surgical side.
He can hook you up. He can take care of you. Dr. Bednar offers free consultations. Call him at 704-366-6700. Again, 704-366-6700, and check out this cream too when you give him a call. Dr. Bednar, it's great to see you.
Thank you.
Thank you.